One of the concepts that we were talking about is ethical dilemmas. And that to me is really interesting for when I actually go out there and I'm on the spot and I need to make a decision. And when it comes to an ethical dilemma, there's two unfavorable choices. Can you elaborate on any ethical dilemmas you had to deal with?
Well, one of the ethical dilemmas we deal with quite a bit here in the nursing home is when a doctor prescribes Roxanol for end-of-life care and it's ordered every hour, and you're torn between not wanting to push the person towards death because with the Roxanol comes a decreased respiratory drive, but you're also not wanting them to be in pain with difficulty breathing, being scared, and not knowing what's coming next.
That's interesting. I think that'll be a hard challenge when eventually I'm out in the field.
It's not easy giving the final dose. I've given that many times. You give it, and then 10 minutes later you have to go in there and pronounce them dead.
Yeah.
It's not an easy thing.
Does it get better, or does it kind of?
You just kind of get used to it.
Because in essence, you're doing the right thing, you know.
It's really hard when you start to actually like the patient and their family, and then, I'm thinking of one instance right now that it was really hard.
I'm sorry.
You just get used to it, and you got to think, you're actually helping the person because, they're in a lot of pain, they're scared, they don't know what's going on. Most of them are out of it anyway, but you're just helping them along.
Thank you for sharing your feelings. Yeah. All right, so another important concept that I thought was really interesting and I'd love to talk about is Florence Nightingale. The founder of modern nursing. She's an inspiration to us all, and she's the reason we're all here now. Can you elaborate on some things you know about Florence Nightingale?
Well, I know that when she came back from training, when she brought back with her was that the conditions that most hospitals were in were very unsanitary. They were dark, they were not well aerated. So one of the things she did was push for, like keeping the air circulation, keeping the windows open, some of the doors open during the summer to keep the fresh air circulating in throughout the building.
Oh, wow. One of the concepts that I thought was very important was evidence-based practice. Evidence-based practice is defined as the practice of nursing which interventions are based on data from research that demonstrates they are appropriate and successful. Do you have any examples to share with us about evidence-based practice?
In simplest terms, one of the things we use in a nursing home is that using Hoyers to transfer reduces the amount of injuries that residents sustain during transfers.
Thank you. And is there anything else you can tell us?
On the nursing side of the house specifically, we've learned that wound vacs aid in wound healing because it continuously pulls all the bad fluids out of a wound from the inside out, so you get healing from the base.
Thank you. It's a very interesting evidence-based practice example. All right, Harold, I know this is a really controversial topic. Let it all out. It's okay. I want to talk about Obamacare. Whether you're for it or against it, I want to hear your opinion on it.
I am 100% against Obamacare.
Tell us why.
Because the reason that Obama wanted to revamp the entire healthcare system was so that 40 million people, uninsured Americans, could get insurance. That means that approximately, 260 million Americans already had insurance. So that means we were revamping an entire system for a minority of the people. Granted, there were people who were having trouble getting insurance, but now that it's been the rollout and everything's starting to happen, you're seeing more people get uninsured because their plans don't qualify for under Obama's new guidelines. So now more people are uninsured than have actually been insured by the act.
Wow, that's really interesting. I wish I could get more into politics, and I know I need to learn about insurance. And
look at the numbers in New Jersey. There's more than 1 million people that have lost their insurance because it doesn't qualify under the new Obamacare guidelines.
And that's really sad.
Same thing in California.
Yeah.
Two very far left states.
Wow. I appreciate you sharing your views. I know sometimes it's hard to talk about politics.
Oh, it's not hard for me.
Well, hopefully that, everything gets worked out in the long run. All right, Harold. So, another concept that is rather disheartening is the concept of lateral violence in the workplace, which is basically bullying in the workplace. Can you elaborate on any instances that you've witnessed lateral violence?
Well, a few months back, we got a new nurse that came from Loomis House. And when she came on the floor, because the other two nurses that worked my shift are older ladies, they're in their 40s, and the new girl that started was 28. I believe that's why they were very mean and very rude to her when she first started. And they wouldn't orient her. They flat out refused to orient her. They told her to her face, and they were very mean to her. And it took them quite a few months to actually start talking as normal people.
It's really sad because that affects so much, like, you know, teamwork, collaboration, person's self-esteem, you know.
Oh, it didn't affect her self-esteem.
Yeah.
Yeah, she knows she's a good nurse.
Well, that's good. It takes it takes somebody strong to work against people that are against you. So that's really, you know.
Plus, it helps to have some people in your corner. I didn't know her personally, but I knew she was a good nurse because I had worked with her more often.
Yeah.
And then Hannah had also started defending her when she got the chance to work with her.
That's awesome. Yeah, because you guys can be the change. I know you guys learned about this relatively a short time ago. And like myself too, when I get out there, I'm be an advocate for people.
Yeah. I've personally never been a victim of bullying, so I can't say what it would be like having to deal with that.
I can imagine it would be hard, for some individuals. One of the concepts we went over is the Nurse Practice Act. Clearly, it's really important, and it's words to live by for all of us. Can you elaborate in detail about the Nurse Practice Act?
Well, I can tell you that it's state-specific, and it tells you what you are allowed to do as a nurse practicing in that state. And it also gives the courts a set of guidelines if someone were to sue you for malpractice. It gives a standard set of guidelines to the courts to judge you on.
Thank you so much. All right. So, Harold, a concept that I think is really great is the concept of being discharged back home, because that's, at a rehab facility, it's where everybody's initial goal is to get better, get back home. So how do you deal with discharge?
Well, once we get the order for the discharge from the physician, we'll write down their treatments and their medications on the discharge paperwork, and we'll go over it with them and their family, whoever's going to be taking over the role as caregiver once they get home. We'll go over the medications and the treatments, and then we'll sign off on it, and then we'll fax that information to the Visiting Nurse Association, as well as the primary care provider for when the patient is discharged from the facility. And that way they'll have all the information that we have while they were in the facility to keep up their treatments at home.
All right, and what happens if somebody wants to leave against medical advice?
Well, we strongly advise against that. One of the things I always tell patients is that if they try to leave against medical advice, is that the insurance companies can come back after them to try to make them pay for the entire stay, because they won't cover it. If you miss anything during your stay, then the insurance company can refuse to pay for the entire stay.
Wow. Thank you. All right, Harold, another concept that we went over is that the family is just as important as a client. It's kind of just this whole entity together. So how do you incorporate the family in with the client?
I try to keep the family as up to date as I can, legally. If there's people in the room, I can't obviously go in, announcing every change that the patient has gone through with their health care, their medications, or what's going on with them. But if it's somebody that I know is on the information list that we have that is allowed to receive information, I can go over stuff with them, keep them updated if they have a new bed sore, if it's the one that they have is getting better, or if they're changing their medications, how they're responding to their medications. Just try to keep the family as up to date as you possibly can, and that way they never feel like they're out of the loop.
What happens if you are legally bound and cannot say anything and a family member gets upset with you? How do you deal with those situations?
You can direct them to ask a family member that is allowed to know, that is allowed to, know the information. And then that person will make the determination whether or not they want to share the information.
Alright, sounds reasonable. Thank you. Alright, Harold, so a huge concept we've all learned about is patient safety. Can you tell me, as a nurse, how you advocate for patient safety?
One of the things that we use in our facility is tab alarms and pressure alarms in our wheelchairs and on the beds. And that really helps patients that are high fall risks. It lets us know that they're trying to get out of bed. Maybe they forgot to ring the bell to call for help to get to the bathroom. And if they're not steady on their feet, they really should have someone there with them, and that just allows us a few seconds, to get in there and help them get to the bathroom safely.
Thank you. Can you tell me about the medication checks you do?
Well, you have to check the wristband. You have to ask the patient, those that are able to respond. You have to check the MAR against the wristband, make sure you're giving the right med to the right patient at the right time, the right dose.
Thank you. All right, Harold, final topic. I appreciate your time, and I love everything you've shared with us. It's great.
It's my pleasure, Jared.
Thank you. Well, I think a huge problem healthcare faces today is a low staff to patient ratio. So can you tell us some consequences that can result from having an influx of patients?
Well, for one thing, it's not safe, and safety is the most important thing in the nursing home. And when you have 45 patients on the floor and you only have 4 aides, and then 2 of the aides take a lunch at the same time, then you only have 2 aides on the floor for 45 patients. And sometimes the nurses aren't able to help because they have admissions coming in. We've had nights where we've had 5, 6 admissions come in, and the nurses just do not have time to help the aides. And then in that instance, you have 2 aides to care for 45 patients on the floor. And that's just not safe at all. Not safe for anybody. Because the aides are running around, they're at greater risk for injury. The residents have to wait a longer time for the call bells to be answered, which increases their chances of getting up without assistance and increases their risk for injury. I mean, it's not good for anybody. And I think one of the big things that they've been trying to push is to have smaller staff to patient ratios, because it's better, but at the same time, nursing homes and hospitals are businesses, and the administrators are only looking at the bottom line. Their end money, their income. They're not looking at safe. In fact, the administrator at our facility has been heard saying that the only reason he has nurses in this facility is because he has to. So, they're only looking at the bottom line. They don't care about the patient safety.
How do you feel like between all the paperwork you have and like all the medications and treatments you have to do?
Well, I have 2 med passes that take about 2.5 hours each. Then usually I have orders to put in the computer for every patient. Then on top of that, in the past 3 weeks, I've had at least 1 admission every night. And the admissions take another hour just to do the assessments to get the patient, and then we have to put their stuff in the computer and call. And there are many times I'm working well past my 8 hours just trying to get everything done.
I can imagine
So they just run out of time.
Yeah. Wow. It's really bad. I can't imagine having to rush around, especially when you're dealing with things as vital as medications.
You're not able to provide the level of care that the patients require, because now with the insurance changes, they're getting released from the hospital sooner than they should be. So they're coming to the nursing home rehab facilities and with a higher level of acuity than they have before, and we just don't have the time to deal with all the patients because we have such a high patient ratio.
Wow. Thank you for opening my eyes to a whole other side of that.
You're welcome.
And I want to thank you again for everything you've shared.